I'm going to discuss the skeletal anatomy relevant to the thoracic spine and the injections pertinent to the thoracic spine. We're talking about the level counting to know what level you are at. There are two ways to do this. You could actually count the levels from the top, or you could count it from the bottom. When you start counting from the top, the first structure that you'll be able to see on the scanning posteriorly will be the second rib, given that the first rib is very flat and has a very horizontal orientation. The other way to calculate the levels of the thoracic levels would be to start at the 12th rib and then move the ultrasound probe up. And once you are at a level which concerns to you, you will then be able to move the ultrasound probe medially, and that will take you to the corresponding thoracic vertebra. With regards to the scanning technique for the thoracic vertebra, there are multiple structures you will be able to visualize, and that's why the skeletal anatomy is important. When you place the ultrasound probe in the midline, the structures that you'll be able to visualize will be the spinous process. Once you move the ultrasound probe slightly laterally, you'll be able to see the laminae, and followed by that, you'll be able to see the superior articular process and the inferior articular process, making up a thoracic zygopofascial joint. Followed by this, when you move the probe more laterally, you will be able to see the square-shaped transverse processes, and then on moving the probe further laterally, you'll be able to visualize the ribs. The way to differentiate the ribs and the transverse process, as you would see, the ribs are superficial structures and they also have round appearance as compared to the transverse process, which are slightly deep and do have a square-shaped appearance on the ultrasound. To perform an ultrasound guided erector spinae block, you will carry on moving the probe more laterally, looking for the transverse process and bringing the needle in plane or out of plane, landing on the top of the transverse process, lifting up the erector spinae group of muscles and injecting the local anesthetic and steroid mixture, and that will allow you to do the erector spinae plane block. Thank you. Now we're going to talk about the thoracic erector spinae plane block, where you would start scanning the midline looking for the thoracic spinous process. Once you've looked at the thoracic spinous process, you will move lateral, where you will see the thoracic facets. You will move lateral, and now you started to see a square-shaped transverse process. The difference between the shape of transverse process and ribs is transverse process have square-shaped, and once we move lateral, you will start to see the rib which are more convex. So ribs are also superficial, the transverse processes are deep. Other thing to keep in mind, when you're looking at the rib level, you will start to see the pleura along with the intercostal muscles and the neurovascular bundle in the intercostal space. To perform the erector spinae plane block, as I said, once you have reached to the transverse process level, you will bring the needle. Either you can do an out of plane technique or you can do an in plane technique. I will freeze the image and I'll show you. So here you can come out of plane technique and put the needle on the top of the transverse process. You can bring the in plane technique, where you bring the needle in from caudate to cephalad, putting the needle on the top of the transverse process, lifting off the erector spinae group of muscles, and the most superficial muscle. Here we have a trapezius muscle. Trapezius, erector spinae group of muscles, and transverse process. So this is an erector spinae plane block. As you could see, there is no third layer of muscle because we are way down. If you keep scanning cephalad, there will be another third group of muscle that will be coming in, will be the rhomboid muscle. Thank you.